Well, good afternoon, everyone. It's 4 o'clock, so we'll go ahead and get started. My name is Andy Feaster. I'm a principal with Development Strategies. I'm based here in Wichita. We're a St. Louis firm and do a lot of work around housing and kind of strategic planning around challenging topics like this. With me, that will help with the presentation and dialogue that we'll have are Richard Singh from our St. Louis office and Angelyn Johnson. And so I'm going to go ahead and get started. What I want to talk about today is what is Home-ARP? What is this opportunity we're talking about? Why did we do an allocation plan? And what are the requirements around the allocation plan? So what can they be used for? The process that we've gone through since June to get to this point of making a recommendation about how the funds can be used and really where we can go from here. This is kind of the beginning of the public comment period. So this was meant to be informational and to ask questions kind of about your thoughts about the focus we'll be presenting and so forth. So it'll be about a 15-minute presentation and time for discussion. So Home-ARP is the city of Wichita received a $5.5 million grant from HUD for Home-ARP late last year. And HUD requires this allocation plan process to determine the needs and gaps in the homeless and housing instability areas of our community by talking with providers and experts in the field who are doing the work on the ground, by looking at the data that is available to understand the scale of need that isn't currently being met, and so forth. So we've been working on that since June. We presented and had a good conversation with council in late September, and now we're kind of moving forward to the final process of getting the plan finalized, approved by council, get whatever additional feedback is needed, and then hopefully get it approved in December, submitted to HUD, so the city can move forward with the projects. The purpose of the program is to reduce homelessness and increase housing stability. It really is a one-time opportunity to fill gaps in the homelessness and housing instability ecosystems. The funds will go away when they're used, and hopefully other supports come to light in the next several years. The homelessness ecosystem, so what are we talking about? Is all the different elements that help people from when they become homeless or are in an unstable housing situation to get to being stably housed. So it can be prevention, getting people back in housing when they're in a difficult situation, or when they become homeless and enter kind of the provider system. What needs are there? Is it temporary housing? Is it permanent housing? What kind of supportive services and counseling are needed along the way to support stability? Is it diversion? Once somebody becomes homeless, getting them back into stable housing as quickly as possible with the supports they need. And part of this process was identifying what gaps are in place or currently exist. Now, in the city of Wichita, all of these elements do exist, but there are some where there's just not enough capacity, whether it's in some temporary housing, emergency shelter, particularly for women, or like robust prevention and diversion programs that keep people from entering the system, or kind of filling in gaps with case management, housing navigation, mental health treatment, and substance abuse, which is a broad community conversation with some really positive movement in the community recently. And then, there's the data. Currently, or in the last year, about 1,700 people were served in the homelessness system. And you can see nearly 300 were family households with children, 140 were veterans, and nearly 1,400 were just adult households without a child. The average time spent in the homeless system is 71 days, and normally a goal is to reduce that time. How quickly can people get the support they need, both short-term and long-term, and into a permanent, stable housing situation. So we looked at a lot of that data to understand what's going on and where there are data gaps, where the community can do better to get better data and support those long-term success. So some of the questions we asked is, what is the best use of these funds? What would be most impactful for the community? What would align best practices with current strengths of the providers? Because a lot of good work is being done. And what is the overarching goal? And Rich is going to go over some of the eligibility for the use of these funds real quickly.
Thanks, Andy. So in this section, we'll be talking about eligibility as it relates to the Home-ARP funds, and that includes the qualifying populations as well as the activities that are eligible to be funded by these funds. So on this slide, you can see the Home-ARP funding can be used to primarily benefit individuals or families from the following qualifying population groups, and that is sheltered and unsheltered homeless population, those at risk of homelessness, those fleeing or attempting to flee domestic violence, sexual assault, or human trafficking, and then other population, which is a broader category that just involves any individual or family where providing supportive services would actually help prevent an event of homelessness. And that brings us to the eligible activities that are eligible to be funded under Home-ARP. And again, that's a broad group of 4 activities: production and preservation of affordable rental housing, tenant-based rental assistance, supportive services, and non-congregate shelters. And we'll be talking a little bit in detail about each one of these in the following slides. So the first activity, which is production and preservation of affordable rental housing, the funds can be used to acquire, construct, and rehabilitate rental housing for occupancy by individuals or families that meet one of those qualifying populations that we just talked about. The next activity, which is tenant-based rental assistance, here the funds may be utilized to provide assistance as it relates to payments towards housing or housing-related costs, such as rent, security deposit, utility deposits, and utility costs. One thing to note here is that funds under this category cannot be used in connection with any home buyer or homeowner programs. The next eligible activity, which is a more broad range of just supportive services to provide in that ecosystem, and the Home-ARP funds can be used to towards costs associated with McKinney-Vento and homelessness prevention programs, so covering costs related to childcare, basic education skills, costs related to providing meals and groceries and those type of costs, in addition to any additional housing counseling costs that can be provided towards supportive services. The last category, the 4th category of eligible activities is the non-congregate shelters. And here, the Home-ARP funds can be used to acquire and develop non-congregate shelters for individuals and families, again, meeting one of those qualifying population definitions. Non-congregate shelters are private units or rooms that can be temporary shelters to individuals and do not require occupants to sign a lease. This activity can include construction of new structures or acquisition and rehabilitation of existing structures like motels or nursing homes, which can be converted into a non-congregate shelter. And one thing to note here is that these funds in relation to non-congregate shelters cannot be used to fund any operations for these shelters.
Thank you, Richa. So what are the needs and gaps in the community? And sometimes asking this question can be overwhelming because there are a lot of challenges. There's also a lot of, like I mentioned earlier, a lot of good work addressing a lot of these challenges. But to gain a better understanding of this, we had a lot of conversations with a lot of the different agencies involved in this work to get a broad range of perspectives and just a better understanding of where they see the greatest needs. The things that rose to the top during these conversations are, needs for non-congregate shelter, particularly for single women, more case managers, housing navigators, and outreach individuals to better meet the continuous needs, but also identify people where they are in their current situation. Prevention and diversion programs, landlord education and engagement. One of the big challenges is that fewer landlords are accepting vouchers and working with this population because the current market has been very strong. So it's easy to lease units. So what else can be done to get more landlords on board with to help house people? Because there are resources available that aren't being used. More safe and affordable housing units, funds for paying utilities, et cetera. And the kind of checked box items here mean that the Home-ARP partially applies. We wanted to highlight, what Rich had just talked through. We want to focus on activities that Home-ARP can fund in this process. The ones that are checked are could be partially funded. For instance, like mental health facilities, the facility cannot be funded with Home-ARP, but the services within those facilities can be. We also conducted a provider survey to get a kind of better understanding and ranking of some of these elements. So in terms of the qualified populations in the city that have the largest gap, those dealing with mental health disorders rose to the top, which is why we're seeing it as a major conversation and potential kind of funding opportunity for the county and city facility they're talking about. But also those dealing with addiction and substance abuse, just the general homeless population, those being at risk of homelessness, and single women can rise to over half of respondents. The priority needs in terms of what can be done by the homeless ecosystem is providing more supportive services, funding the kind of the open positions for case managers at a minimum, but adding more housing navigators and supports for, again, that long-term success and being able to cater to what individuals need to reach stability. Affordable rental housing, nonprofit operating funding, non-congregate shelters, and then we get to rental assistance and capacity building. The last one is about specifically about what types of supportive services, and case management services again rose to the top. Homeless prevention and housing counseling, those kind of things are really important to the providers who took the survey. The other thing we looked at with Homebase, a partner on this project, is how do these needs align with best practices in communities that have taken sometimes a new approach and are starting to show success in reducing both the kind of like a shelter, reducing the time staying in a shelter, reducing the period of housing instability, and reducing the return to the homelessness ecosystem that can happen when long-term supports and other things happen over time. And these are really low barrier housing focused shelters, prevention and diversion programs, and kind of landlord outreach that provides kind of a more holistic approach to each individual case. And a lot of what is being recommended in this plan align with best practices and have the goal of reducing homelessness in the community over time. So what are the recommendations? There's still an immediate need for housing units in this community. That rose to the top in a lot of our conversations. So working with kind of the city team, with Homebase and our consulting team, as well as studying best practices, we kind of are asking the question, is a navigation center with housing units the best use? And this is what we are recommending as a priority project in the Home-ARP allocation plan, is a single project with a navigation center, non-congregate shelter units with secure and safe units reserved for women, and with affordable housing units. And this type of facility would provide, in the navigation center, one place for individuals to be connected with all the services they need. We heard a big challenge in the community is that there are services available, but it's really difficult to navigate how to get to each one in the different locations with the different agencies in the city. This would help bring that together and coordinate efforts. Non-congregate shelter, there is no facility for no low barrier facility for single women. and there are limited low barrier options in the community. So there's still a need to get people in a shelter unit and connect with services, and this would help accomplish that. And then affordable housing units, really to help that immediate need of there are unused vouchers because people cannot find a unit. And so the funds are there for housing them, paying rent, but the units aren't. And in the plan, we've recommended this allocation of funds among the different uses, $500,000 to help support the supportive services represented in the navigation center, $2 million for non-congregate shelter, and the remainder are nearly $2.2 million for affordable housing units. Home-ARP does allow that 15% go toward administrative costs, which would be the city's costs of administering the funds, doing the monitoring and compliance over time, and making sure funds are used for what they are intended. If not all of those funds are used, they can go back into programs. The city has that flexibility. And there's also flexibility depending on how proposals come in to kind of adjust the amounts among the categories. There is a threshold HUD allows to, for instance, move more money to non-congregate shelter. One of the key challenges in this approach is capacity. Is there capacity within the provider network in Wichita specifically to operate on an ongoing basis, a long-term basis, a non-congregate shelter? It would be a very important asset. They are costly to operate, and Home-ARP funds cannot go towards the operations. So that would need to be fundraised. And for HUD to approve this plan, there would need to be a level of comfort that there is that capacity to go down this route. Affordable housing units, there are other programs out there to leverage to make these more feasible, be it tax credits or other types of programs. Additional funding can come to the table really to support all of these uses, but in a way, the affordable housing units are the lowest barrier option in this program. So the priority project would include all three, aimed at really meeting the primary needs identified through this process. The way the Home-ARP allocation plan is written today, and the way we hope to move forward, is that if a priority project that includes these three components is not identified and approved within a year, then the notice of funds available would be modified to allow funds to go to any specific use. So an entity could do affordable housing units and not the other two, and for any of those different uses. So that is the plan. And now before we go to questions, again, our next steps are to complete the public comment period. There's a survey that will be out there. These links are posted in chat. The allocation plan is available on the city's website. You can email additional feedback to Mark with the city, and there will be an in-person public meeting at November 16th at the Advanced Learning Library. So this is really the time to think about, is this the best approach for the city? Are there things you want to communicate that would help refine and revise the plan before it goes to council on December 6th, which will be the formal public hearing? And that, we're going to transition to kind of some facilitated discussion. We have a few questions, and we're happy to hear your thoughts.
So good afternoon, everyone. As Andy introduced earlier, my name is Angela Johnson, and I am the CEO of Community Connections Consulting Services, and supporting this project and gathering thoughts and feedback from the community on what has been created thus far. So as Andy shared the process of how the city has come to where the city is today. There was an opportunity to engage with organizations that are already involved and engaged in this space to get feedback and perspective on how to best utilize and structure how the city moves forward in the utilization of the funds and the creation of the allocation plan. That took place earlier. There then was a determination of needs and gaps. There was conversation through a council workshop with city council to gain additional feedback from city council. There was a prioritization of needs as well as identification of best practices in other spaces that have proven to be successful. And then there came the creation of a plan, which has been provided. At this point, we want to provide opportunity for questions and perspective from those of you who have joined the call today to give further thought on what is being proposed. So we do have 3 questions that we want to ask of you all. And this is an opportunity for and a request for engagement from you. We want you to lead this conversation and lead this discussion and really provide your thoughts and perspectives on what has been shared both in this presentation and in the drafted plan that was made available on this past Friday, the 28th. So the first question, as Andy shared, this has been designed as a single project that will include a navigation center, a non-congregate shelter, and affordable housing units. What is your thought and perspective on a project that has that singular focus on one project, one location that contains the navigation center, the non-congregate shelter, as well as affordable housing units? Are you in agreement with that? And if you are, we will want you to share in the chat if you can, but this is a relatively small group. So there's opportunity to share freely by coming off mute, but we do want to capture your sentiment in the chat as well. So you can add it in the chat so we can capture it for the record. But let's begin with number 1. Do you agree with the focus on a single project that provides a navigation center, non-congregate shelter, and affordable housing units? Why or why not? I see Officer Nate has provided a perspective already. Officer Nate, are you able to come off mute and share a bit more about why you're saying yes on number 1?
Yeah, I mean, I think it's extremely important for the community, especially homeless, to navigate into one central area because of they seem to get lost when all the resources are in different areas. I had an opportunity to go down to San Antonio and look at their Haven for Hope. Now, I understand we're not trying to duplicate that. We're going to do it what fits best for Wichita, but I mean, it seemed like a really good approach, especially transition, get someone to a location, especially for officers, not just the hot team, but every officer in the city be able to know they have a resource to go to, that someone's going to help them navigate through everything, get them the immediate care, which would be the shelter part, and then look at that transitioning out and into housing, supportive housing, and the other programs that sometimes take time to get that paperwork process. So I think it's an amazing model. I definitely think that would work here.
Thank you, Officer Nate. And please feel free to, if you want to capture additional thoughts and follow up to that, to place that into the chat. I see Julie has added a perspective, a couple of perspectives. Julie, are you able to speak to us? You may not, I see you're on mute. And if you're unable to come off mute, we could take your comment as you presented in the chat.
Well, I'll tell you what, man, you've been down for that long. It sounds like you're doing stuff.
Did you want to share with us, Julie, more about your comments?
Here and help you.
Okay. Understood. So what Julie has shared, in case everyone is not able to see the chat, she's expressed a concern about the amount of the allocation not being enough to get the navigation center started. She also has highlighted consideration of potential sites, specifically for an affordable housing option. Are there any other thoughts on the approach of focusing on a single project. And Richa is continuing to capture those that are in support, as well as those who, the comments that are not necessarily in agreement. Again, any other thoughts or feedback for the first question? Okay, let's advance to the second question. So the second question looks at priority needs and how the plan is looking to address those. First of all, the identification of what are those priority needs and how the plan is situated to address those priority needs. The question is, are there priority needs around homelessness and housing insecurity that this plan does not address? Is there any thoughts or feedback to the second question? Now, there is an assumption in that question that you've had an opportunity to review the plan, but some things have already been, but the plan has been shared in this presentation. Is there any feedback from what you heard regarding the areas of priority that have been identified so far? Okay.
Do you want, I'd like to add maybe just a word for thought, maybe get some other people thinking about it. You know, all of that consultation, we heard a lot about the need for the connection to mental health and substance abuse. And really, I mean, the Navigation Center can be a first point, but one of the things we've definitely heard after the development of the 316 Hotel into the studios at Humankind was that there isn't that next step. There are going to be folks that either that, and that's permanent housing, that the case management that they can get on site just is not enough. And how is it that we can establish when we have cases, not cases where people have just, you know, given up on somebody, but where does someone go when that's not the answer? The NABS, you know what I'm saying? That the non-congregate shelter or the affordable housing on site. How do we establish those connections so there is somewhere for that person to go? And I think that is, I mean, I don't know that we can answer that with Home-ARP, but I think it needs to be answered and addressed as we identify how a single project could work. So just wondered if that might get some thoughts flowing from some others.
Are there other thoughts and feedback to what Sally has just shared? And I do see there's comments coming in the chat as well. Let's see. So Pam has shared, so I did place the link to the plan in the chat for some reference as well. Pam has shared a question of if we're addressing, what are we addressing support systems to improve success? Something to be mindful of about how support systems that improve success are being incorporated and addressed within the plan. Pam, did you want to speak to that? Let's see. Okay, and Pam may not be able to come off mute, but we have taken note of that.
Okay, I came off mute. So
Yeah.
I have been working in case management services and now I'm in housing. And what I have seen is, especially people long-term on the streets, they have lost a lot of their skills to maintain housing. Sometimes we have to start with the basics. You know, budgeting, cleanliness. You know, they've lost those skills and we have to go back to those basics to help them succeed.
I absolutely agree with you, Pam. Oftentimes when we talk about caseworkers working with people experiencing homelessness, people are thinking clinical, they're thinking mental health, substance abuse, but there are so many other skills like you're talking about and other needs and barriers that aren't addressed by a clinical caseworker. They
Absolutely.
really, right?
Yep. I mean, I come from the mental health world, so I get it.
Yep.
But there's no reason it shouldn't be addressed.
Okay, noted. Thank you.
Well, and then, I have a question on this till, you brought the 3 6 up. Are they gonna be held accountable, to be getting a job and stuff like that? Because, I previously was in that situation and I felt that it was being abused, and I just want to throw that out there. I don't want to make anybody mad, but
I'm not quite sure your question. Are you asking if all persons residing or staying in the
Yeah,
shelter
yeah,
or
yeah.
residing will be required to get a job? Not everybody will be
Well,
capable of
that-
getting a job. But
that
there will
or
be,
that
there'll be a,
or
I was
yeah,
just gonna say,
or
there'll be
that or
a
to better
plan.
themselves,
Yeah, there's gonna have to be a plan. People can't
Mm.
stay in non-congregate shelter forever. They need to develop a housing
Right.
plan and how to move them into housing. And then you hope to get people to a point where they can get to being able to be self-sufficient and afford their own housing. For some, you can
And not
get there and others you can't.
Yeah, not necessarily just the job thing, but even like the mental health or, the stuff that we offer, and they, here they have somewhere to stay, but they don't want to help, the case management or any of us, move forward. I mean,
My program actually has what we call a self-sufficiency plan, and what that looks like can be different for everybody. It's an across the board thing, but maybe incorporating something like that where they can set some goals for themselves, and then you can build in the accountability piece to that. The goals don't have to be huge, like find a job. It could be something like, I don't know, sometimes it's just medication management, learning how to take their meds appropriately, that kind of thing.
Thank you for that feedback. I'm going to take a brief pause because we've had a number of individuals that have joined us just to share where we are and what what part of the discussion we're in right now. So what has already taken place is a presentation that covered the plan and gave additional details to what is being proposed. What this conversation today is an opportunity for public feedback on the plan as being proposed, and we are going through a series of 3 questions to get feedback from those who are participating with us live now, and it will also be an opportunity where this video would be shared for additional public comment and feedback on the proposed plan. What is in the chat is a link to the plan where you may be able to peruse as we are talking, to give you opportunity to see specifically what the city has drafted so far. But we are taking opportunity for feedback. What everyone has been asked to do, and this is going to be especially more important, even more important now because we have considerably more people who have since joined us and are joining us, is as I ask the questions, if you can put your feedback in the chat, and we will capture it from the chat, and then we're giving opportunity also for some verbal further expression of what your thoughts and feedback is. So that is what we are doing at this point. I'm going to go back to the chat because even as I've been talking, there have been some additional comments. I believe that the next comment was with Officer Nate regarding a detox center. Officer Nate, did you want to speak a bit more to that? Are you able to speak to that?
Yeah, I mean, just that our experience is that most of the time, I'd say 9 times out of 10, we can get someone into detox and they have had beds available. The issue becomes when they need inpatient treatment for long term, and that's we're talking 30 to 90 days worth of inpatient. That typically for someone who's uninsured, which is a majority of our homeless, that's 3 to 6 months. And what we've seen, and also when you talk to SAC, their case managers, what they've seen is that those individuals often relapse and they go back to the streets from detox, and then they miss their appointments and they start the whole process over. So that's kind of I would say inpatient treatment as a gap in the community that I didn't see that was in the plan.
Okay. Thank you, Officer Nate. I see another question that was posed is how long are we scheduled to be on the call? I believe we allocated an hour total from the start time, which was 4 o'clock. So we have 25 additional minutes available for continued conversation. The next comment that was captured was from Pam, skill building is a must. Understood. Julie has brought up the need for landlord dollars to incentivize participation when units are damaged. We know that the city has some projects and things happening. Sally, can you speak to how that could fit into this project?
So, we do have a couple of other initiatives going on related to Project Hope, which is going to really relook at how we do case management, and provide services through a team of people that can provide a different skill sets and different perspective to those. We have a homeless task force that's being stood up that's going to be charged with trying to help identify additional funding and additional best practices for our community. So Home-ARP isn't the only thing going on. We have a lot of other things going on that we hope in the long run we'll be able to bring all these things together in order to provide the best ecosystem really for serving homeless in our community.
Thank you, Sally.
Yep.
So continuing with the comments, Julie has shared a idea and a thought about money being deferred to USD 259. So that to me, that speaks to partnership and what that could look like. Julie, did you want to make any additional comment to that? Okay. And still continuing through the chat. Okay, I believe those are all of the statements related to number 2. Again, I know we had a number of individuals who came on at 4:30. Is there any additional comments related to the second question that you have? Okay, let's advance to the third and final question. So again, in the plan, we're talking about $5.5 million, and there is a budget that has been created that shows a distribution of how those funds are proposed to be utilized. That is found on page 27. If you, for those who were not present at the top of the call when we went over it in this presentation, the link to the plan is within the chat. Please let us know if we need to reshare that if anyone came in after and it's not showing for them. Considering the distribution that's being proposed, question number 3 is, do you agree with the distribution of funds amongst supportive services, non-congregate shelter, and affordable housing? If you do not, how would you recommend the funds be allocated? And again, you can find that distribution on page 27 of the plan. Is there any thoughts or feedback? Let me go to the chat. And giving everyone some time to navigate to that portion of the plan. And I see it looks like some people are taking some time and taking a look at the document. Is there any feedback so far? And as we're waiting for and giving opportunity for attendees to look at that, from the city, can you share a bit about, again, the amount of the funding and how it's been distributed so far in the plan?
Sure. HUD requires that we we break it up and distribute it amongst possible program areas. It's a shot in the dark, I'll be honest with you, until we actually see a proposed project and know where the gaps are. We really don't know in which bucket. We have that flexibility to be able to move. If we get a proposal that needs more money for supportive services or less money for, you know, another category, they can be moved around so long as the category is there in the plan. Obviously, when we're looking at, you know, almost the same amount of money for the non-congregate shelter as the affordable housing units, part of that's because there are a significant number of other funding sources to build affordable housing. And affordable housing is self-sustaining in that you, the revenue you collect in rent, if you design it right, can support the operations. Whereas a non-congregate shelter, there is not a lot of funding available either for the capital and then obviously for the operations. And so, you know, having that equally weighted, although we believe that you get a great deal more affordable housing units out of the 2.12 million than you will rooms in a non-congregate shelter, which is really, as I said before, kind of a shot in the dark until we see an actual proposal.
Thank you, Sally.
But then, you know, the idea to not put funding in tenant-based rent assistance or in other areas that provide maybe a short-term answer right now doesn't provide anything in the long term, right? And that's even to, you know, if we wanted to provide, you know, funding for case managers now, that's great. That's going to help about 15 people right now. And once it's spent, it's done. Where we look at this as an opportunity to invest in, you know, in a physical asset that can serve homeless populations for decades.
Thank you.
Mhm.
So with that, from attendees, are there, and Richard, thank you for adding the amounts that have been allocated in the plan. Having that before you all, do you have any thoughts or perspective? I do see some comments have come through. Some funds should be allocated to TBRA. There's a comment, I think the service is a little low. Most coming into this would need some kind of support, I would think. Other thoughts? Okay.
I would add on rental assistance, the reason we didn't prioritize that is because there are dozens, if not a few hundred unused vouchers right now where there's just not a housing unit. There were 137, this was a month ago, unused. Was that the homeless specific voucher, Sally?
Homeless specific vouchers and another 200 on top of that, regular vouchers that can't get leased up in our community.
So that put the focus more toward getting more affordable units online that would accept vouchers as a priority.
Thank you for that, Andy. Any additional thoughts or questions regarding the allocation of the funds as currently proposed?
Hey, Andy,
Yes.
I just noticed that the Continuum of Care sent out the notice today about this meeting and said it started at 4:30.
Okay.
Do you want to do a run through of the slides real quick for the folks that were not on? I know it only took about 15 minutes, so.
Mhm.
It looks like at least more than half of the people that are on were not on when you did it. Sorry
Yes,
for those who were here.
I can do that.
Okay.
Okay, again, sorry about that mix-up. The intent of this meeting is to provide a quick overview of what Home-ARP is and what it isn't, what the funds can be used for, and what populations they are intended to serve. A little bit about how we determine these needs and gaps. So how did we get to this recommendation? And then kind of the recommendation that we just talked about in that last question, and we pasted the kind of amounts that we've settled on for now. So Home-ARP was this $5.5 million grant through HUD, intended to help with homelessness and housing insecurity. HUD requires this allocation plan process where we're required, but it's also very useful to have consultations. We had one-on-one conversations with many of the organizations that serve these populations in the community. We also looked at the data, the homeless data that's available, the data around these populations that's currently available, as well as some national statistics to understand the scale of the need, units versus people. And then we did present this to the council on September 27th and have general support so far. And then kind of the next steps are this period, public comment period, where we're having this information session. We're going to have an in-person public meeting on November 16th at the Advanced Learning Library that will start at 4:00 p.m. That's 4 o'clock, not 4:30. And the hope is to submit this to council on December 6th at the formal public hearing for approval so that it can be submitted to HUD, and that early next year, the city will be able to publish a notice of funding and start working on receiving applications and finding the right project. So this, like Sally said, this is a one-time capital injection, a one-time opportunity where these funds, they need to be used by 2030. They will go away after that. And hopefully some other programs and funds will come available by then, but that's kind of an underlying perspective of why a facility that has these three components, because these funds can help make that happen. We looked kind of at the whole homelessness and housing instability ecosystem, ranging from those who are unstably housed at risk of homelessness, what are different prevention options? Those who become homelessness, and kind of what are the options in terms of temporary housing, permanent housing, and all these supportive services that underline each phase to reach housing stability. We identified, kind of based on our conversations, there are a lot of gaps. There's a lot of good work being done, but there is a need for additional support in a lot of these areas. These are some of the key statistics today that we have, the best information available, and one of the things we identified, and I know that COC and communities working on, is how can we better collaborate on having the right data to continue to get people the services we need over time. Really, the questions guiding this at the beginning is, what is the best use of the funds in the context of what would be most impactful in the community? How do we align what the community providers are doing with best practices that are showing to reduce homelessness, to reduce housing instability, to reduce shelter stays, etc.? So what is the goal? I'm just going to keep going, Richa. The four populations, HUD defined four qualifying populations. They are the sheltered and the unsheltered homelessness. This includes veterans who are homeless and unsheltered or sheltered. It includes children. It includes women. It includes all of those. Those at risk of homelessness, those facing eviction or poor housing conditions or other housing challenges where they're close to losing their homes. Fleeing or attempting to flee domestic violence, sexual assault, or human trafficking is its own category in this program. And then other populations where supportive services would prevent homelessness. This could be those with disabilities or other factors that are creating housing challenges. The four ways in which these funds can be used are production or preservation of affordable housing, tenant-based rental assistance, supportive services. Almost any supportive services that is currently provided or could be provided to the qualifying populations is really allowable, is fundable through Home-ARP. It's a very extensive list in the guidance they provided. And non-congregate shelter, which could be acquisition or development of. A couple of quick notes in each of these categories. It can be construction of new units, acquisition of existing units, and but renovated. They can be used to refinance existing affordable housing, but that's not something that we're recommending in this plan. It can be used for rental assistance, which is does include ability to help with utility payments and deposits. It cannot be used for home buyer programs or homeowner counseling. Supportive services, we couldn't fit all the words on here, but case management, housing counseling, mental health support, substance abuse support, the basic kind of skills counseling that we discussed a little bit earlier before the bulk of you got on board, but a number of different services. And non-congregate shelter, the challenge with this funding is it will fund the units, the facility, but it will not fund the operations. And a note about the facility that's important is non-congregate shelter in HUD's definition must have private bathrooms. This is where a hotel conversion could make a lot of sense, but it can have shared kitchens. And the funds can be used to convert non-congregate shelter to permanent affordable housing. So in terms of figuring out what the needs and gaps are, we had a lot of conversations, one-on-one conversations with these groups and others in June, July, and August. What rose to the top in our conversations are these different items. And just a quick note on the color coding, we wanted to highlight what's eligible for funding through Home-ARP. And this kind of squiggly, I don't know what to call it, is partially supported, like the quality of housing units. You can renovate housing units to improve the quality. You can provide mental health services, but not fund a mental health facility. But all of these other items that were mentioned by most of the organizations we spoke with are eligible. We did a provider survey that kind of highlighted some of these and reiterated a lot of the conversations we had. So those who took the survey identified populations dealing with mental health disorders as the highest need in the community. And there is broader community work on this issue and discussions about a new facility for mental health and substance abuse, which would ideally be combined with a navigation center, but we'll see where we get, right? And then other populations here, those at risk of being homelessness, currently homeless, and single women. In terms of priority needs of what types of activities this should fund, supportive services, affordable rental housing, nonprofit operating funding, non-congregate shelter, all rose to the top. And then specific supportive services to fund would be case management services, prevention, housing counseling, life skills training, and job readiness. So the other thing, after we had these conversations, we worked with our partner Homebase, which does a lot of homeless capacity building nationally, about what are some best practices that get at these core issues. They are low barrier housing focused shelter, prevention and diversion programs, and landlord outreach. And we have separately kind of statistics on how some of these programs are reducing stays in shelters, are increasing the likelihood of permanent housing, and really with the goal of reducing the incidence of homeless and housing insecurity. And so that got us to our recommendations. There's still an immediate need for housing units, like we just talked about a little bit. Is a navigation center with housing units the best use? This is what we are recommending as the priority project to be funded through Home-ARP. That would include a navigation center, non-congregate shelter, and affordable housing units. And this is the distribution, again, that we are recommending as a starting point. Today, again, the city has some flexibility as if proposals come in, that the allocation needs to be adjusted. They have some leeway. And there is our funds towards administration. This is the city's ongoing monitoring and administration staff time related to the program. If it's not used, it can go back to any of these elements. Another note, we are prioritizing a single project if this goes forward as is, and gets approved by HUD, the city will issue a NOFO, notice of funding opportunity, that will ask for proposals that have a single project that accomplishes, that includes these three elements. The way it's written today is if that's not received within a year, excuse me, that a new NOFO will be issued that allows for funding and allows for proposals for any of these three. So that's kind of how it's structured today, with the recognition that operating non-congregate shelter is expensive, and the provider community may not have the capacity to do that in this time frame. And so there's a need to find a partner or group of partners that has the capacity to execute this, not just in development, but for the long term. And that's something HUD is interested in as well. And so that is the overview. We pasted the links in the chat, but you can take a survey about this to provide feedback. You can send feedback to Mark at the city, and we're happy to go back into discussion.
Okay. So as Andy shared, he recapped what had been previously discussed. The Wichita Housing Community Services Department's website has been highlighted a number of times, and I encourage everyone to visit that site. On that site has the listing of the public engagement dates, as well as the start times for the next engagement, our next one will be the in-person next week. So please know you can look to the city's website to have that information, as well as access to the documents and the recording, as has been shared in the chat. So when the majority of you all came onto the call, we had just went through the presentation and we're answering 3 questions. I think the majority of you all came in on the second. So we'll revisit the first question and open back up the conversation and dialogue for, technically we have 3 minutes remaining for this session, but we can quickly take any comments. We ask that the comments be put into the chat, and then we'll transfer them over to the shared document. Is there any immediate feedback on the first question, which was, do you agree with the focus on a single project that provides a navigation center, non-congregate shelter, and affordable housing units? And then we asked why or why not. Now I know, I think someone's ready to speak. So I know we have very little time for remaining, but that does not mean that there's not the opportunity to continue to provide your perspective, your thoughts, your feedback to what's been proposed. Andy, can we put back up the methods for how to provide feedback? Whoever is handling the slides. And we encourage you all to continue to think, reflect. The link to the plan has been provided in the chat, as well as will be available on the website. Between now and next week's in person, you will have the opportunity to provide your direct thoughts and feedback. And then also join in person on what is the date again? It is next, let's see, let me get the exact date. There it is, the 16th. Thank you, Andy. To continue conversation and dialogue about what is being proposed. But with that, I will turn this back over to Andy for closing us out.
Okay. Well, thank you all for taking the time to attend. I apologize again for the start time confusion. Again, please take the survey or reach out if there are additional thoughts or comments. We want to get this right. This is the time to refine it before it is submitted to the City Council and HUD. And so the goal is to make these funds available to improve the community and improve how improve the situation for those who are at the most risk. And so thank you very much.
Thank you all.